Yeah, that's right. I'm the author of The Obesity Paradox. And the reason for this book is that my colleagues and I think, have had some groundbreaking research during the last decade, or last 15 years, that in a lot of ways has turned conventional wisdom on its head. That our book talks about the fact that fat is not always the devil. And that, in fact, fitness is much more important than weight for predicting long-term health outcomes. Now, in a perfect world, everyone would be lean and fit, but that's not what's happening in our society with aging. Many people are losing fitness and gaining a lot of weight. And we talk about the fact that if you're gonna lose one of those, it's much better to gain some weight and remain fit, because fitness ends up beating fatness for many health outcomes. And in fact, the heavier person who's fit is actually healthier than the thin person who's not fit. So we drive that point home many times in our book. And the other thing is that we point out that although weight gain promotes adverse cardiovascular risk factors that I talked a lot about at this conference, lipids, blood pressure, glucose abnormalities, inflammation, and increases the risk of many cardiovascular diseases. We and my colleagues have published many papers showing that in groups with cardiovascular disease, like hypertension, coronary disease, heart failure, atrial fibrillation, the overweight and obese are actually doing better than the lean patients with those same diseases. Completely opposite of what I would have predicted 15 years ago.